Good evening and thanks for joining us. More and more COVID-19 vaccine rollouts are coming to Indiana and Illinois, but now many are wondering if this means quarantine guidelines will be changing.
Those guidelines have become more relaxed for people who have taken the vaccine. News 10's Blake Dollier is live in the studio tonight. He breaks down what to do if you come in contact with someone vaccinated or not.
Patrice Rondrell, doctors admittedly tell us that things are becoming a bit puzzling right now. The big question many vaccinated folks are asking themselves is, should I quarantine? I sat down with local medical professionals today to see what they say to do and what they're thinking. Hospital staff say they're becoming overwhelmed.
It's been a real trying time for all of us.
Melissa Toon is the director of pharmacy at Greene County General Hospital. Her daughter just started her nursing career and she says she's seen the worst of the pandemic.
It's taken a toll on her. It's a lot of people that she has taken care of have died from COVID. And for a new nurse right out of school, that's a shock. That's not what you think is going to happen.
This is why she says taking measures like quarantining are critical. With the vaccine rollout, Vigo County Health Commissioner Dr. Darren Brucken says the question of whether to quarantine has become a bit unclear.
The quarantine rules are extremely confusing for everybody because they're always in motion. They're always changing.
He says if you're fully vaccinated and come into contact with someone, it's a good idea to get a test in 3 to 5 days. But if you're asymptomatic or test negative, there's no need to quarantine. Dr. Brucken says in this case, wearing a mask will do. But if you're vaccinated and you have symptoms of COVID-19, you should isolate. However, if you're unvaccinated, Brucken says if you come into contact with someone that's even suspected of having COVID-19, you must isolate for 14 days.
Quarantine is not a punitive measure. It's not a punishment. You know, it's designed to help slow the spread and to protect those people that need protected.
Healthcare workers say with a disease like COVID-19, they need your help in keeping people out of the emergency rooms and ICU. Toon says recent spikes in cases have led workers to feel like they're losing hope.
COVID is just such a terrible virus that there's some cases where you do everything that you can to help people and there's nothing that you can do.
Officials say by taking these steps, you can help. They say right now hospitals are beginning to fill up with COVID patients. They say they need your help to stop it. Patrice Rondrell, back to you.